Table of contents. This is what I'll be discussing throughout my presentation. What is hepatitis B? How HBV is transmitted? What hepatitis B does to the body? Signs and symptoms, long-term medical problems, treatments, and prevention. What is hepatitis B? There are two types of infection. There's acute HBV and there's chronic HBV. Hepatitis B is a global public health issue. There's about 350 million people in the world that is diagnosed with chronic hepatitis B. According to the Centers for Disease Control and Prevention, there was an estimated 20,900 new HBV infections in the United States in 2016. HBV is a contagious liver disease that ranges from a mild illness that can last from a few weeks to 6 months, or a chronic/serious lifelong illness that is anything more than 6 months. As you can see in this graph, any green is less than 2%, which is low. Any yellow is 2 to 7%, which is intermediate. And all the red is above 8%, which is high. What does hepatitis B do to the body? Once the HBV virus enters the bloodstream of a newly infected individual, the virus travels to the blood to spread the virus throughout the blood so it can get to the liver. The liver is a targeted place that the HBV virus wants to travel to. During the acute stage, the virus invades the immune system and attaches itself to the liver cell. Once attached, the virus penetrates the liver cell and it invades the nucleus. Inside the nucleus, the virus converts the cell DNA to HBV DNA, which then allows the virus to replicate and enter the bloodstream. The new virus particles can go on to infect other sites, and therefore it will start traveling throughout the whole liver. And this is why a lot of people with hepatitis B virus usually die, because they end up developing cirrhosis or liver disease, liver failure, or liver cancer. How is HBV transmitted? HBV is transmitted through infected blood or bodily fluids. And this can be from unprotected sex, contaminated needles, direct contact with blood, and a mother can pass on the HBV virus to their newborn baby by labor and delivery. Long-term effects and medical problems. Long-term treatment can cause major medical problems like antiviral resistance. The expense of combined therapies, medication, and treatment is very expensive, and that has a long-term effect on patients. Chronic HBV is highly likely to become cirrhosis, liver failure, or liver cancer. Signs and symptoms. Infected people can go throughout their whole life without even knowing that they've been infected with hepatitis. Symptoms are usually mistaken for flu-like symptoms, which are fever, nausea, fatigue, loss of appetite, vomiting, abdominal pain, dark urine, clay-colored stool, joint pains, and jaundice. Symptoms can start to appear 90 days after being exposed. Facts. Once you've been recovered from hepatitis B virus, your body develops antibodies that protect you from ever getting hepatitis B ever again. The patient gets chronic hepatitis B only after they've had the acute HBV virus for more than 6 months. Another fact that I thought was very interesting is that the HBV virus is the smallest DNA virus known to man. Treatment. There is no medication available to treat acute hepatitis B. Doctors usually recommend rest, adequate nutrition, and fluids. People with chronic HBV will be monitored regularly for signs of liver disease or liver failure. Patients should avoid alcohol at all costs because it causes additional liver damage. They should also check to see if the medication they are currently taking are safe to take with the virus, and to make sure that those medications will not disturb the liver anymore. Prevention. The best way to prevent getting hepatitis B is by getting the vaccine. This vaccine is usually administered while you're an infant. The shots are given in a 3 to 4 shot in a 6-month period. The shots simulate a person's natural immune system to protect them against HPV. Like I stated before, this will help your body make antibodies so it can protect them from contracting the virus. Another interesting fact that I found was that the HPV virus can last on any surface outside of the body for 7 days. This means that if the virus is on any surface and you come into contact with it with an open sore, then you are at risk of contracting HPV virus. And that is why it's very important to make sure that you have been vaccinated with the HPV vaccine. This is my works cited, and this is where I got all my information from. I hope you enjoyed listening to HPV as much as I've learned about hepatitis B and how dangerous it really is. Thank you.